On our health report tonight, another case of trying to get the insurance companies to pay for a medical treatment that some people think is just the ticket. In this case, a procedure to unblock clogged arteries that does not require surgery. In fact, the easiest way to understand what happens is to imagine what Drano can do to a clogged pipe. Not everyone in the medical community is sold on this experimental therapy, but a growing number of people are. And here is ABC's John McKenzie.
For Alan Hay, the memories are all so vivid. He was 51 years old and about as rugged as they come. He owned a guest ranch in Montana, worked as a trail guide, and ran a logging business. Then a heart attack 2 years ago brought a sudden and profound change.
Just the normal, everyday things that you take for granted are suddenly gone. Just walking, getting out of bed, climbing upstairs was very difficult.
So Hay signed up for a controversial treatment to open his clogged arteries. It is called Chelation, a therapy now so popular that 500,000 Americans use it each year. It's an intravenous drip that passes through the arteries, removing calcium deposits that contribute to clogging.
With chelation therapy, we're able to increase blood flow and then reduce the need for medication and surgery. So therefore, there are fewer side effects and complications.
A series of 20 chelation treatments, that's about the average, can cost a total of $2,000. The problem is, insurance companies won't pay for it. Although chelation has been approved for ridding the body of heavy metals such as lead and mercury, it has not been sanctioned for use in heart disease and the opening of arteries, even though many patients report profound benefits.
The questions can only be answered scientifically. And I think physicians simply recognize that there are not substantive, meaningful studies published that demonstrate it is effective.
We're going even 13 minutes.
But Alan Hay and his doctor are convinced. After 20 chelation treatments, he completed a rigorous stress test.
After a heart attack, you expect the function of the heart to be abnormal, and in this case, his heart looks like it didn't even have a heart attack.
Is that unusual?
Very unusual.
I feel better now than I did before I had the heart attack, to be honest with you. I'm in great shape.
These cases are now common enough that some doctors say it's time to finally put this treatment to the test with a large, tightly controlled clinical trial to see whether a relatively simple therapy is actually responsible for some remarkable recoveries. John McKenzie, ABC News, New York.